Yeah, ladies and gentlemen, I welcome you once again. Good afternoon, good morning, good evening, no matter where you're tuning in from. You can share the link to this page, to this webinar, such that we can have a bit more people join us for the discussion because it's important. I believe that for every awareness and educational session as this, everybody who joins in becomes an ambassador for the community where they hail from. So I believe it's important for more people to join us. So feel free to share the link to this discussion in those chat forums that you belong to, such that more people can join us. In the meantime, let us welcome our guest speaker, who is Suzan, to introduce herself, who she is, what she does, such that people can just know who is behind the microphone and what do you do, and then we can get started with the introduction of the topic.
Good evening, our audience. Thank you so much, Dr. Mutunga. Eric, thank you so much for having me. I have not interacted with me before, so that you're able to put the voice with the face together. My name is Suzan Akwii. I am a clinical psychologist by training, and currently I lead an organization called Wellnest International, where we provide mental health services across the socio-ecological model from the individual to family to community, and also at institutional and policy level. I also represent the Clinical Psychology Association of Uganda for the Northern region. Happy to be here, happy to deliberate on these issues of mental health, and very, very happy to be a part of the Safe Drive campaign. Thank you.
Thank you so much, Suzan. And Dr. Eric, please say hey to us. You're the mastermind. You're the reason as why we're here. You and Gen Health Foundation. Yeah, from CPHS Uganda, we are so happy. That's where I'm coming from. We are so happy to collaborate with Gen Health Foundation, with Dr. Eric and Team Gulu. Yeah, this topic couldn't be more dire. We know what is happening in Uganda. It's almost every day that we see road accidents and all that. Yeah, I don't want to preempt the conversation, but yeah, Dr. Eric.
Yeah, thank you so much, Dr. Mtung. Just a disclaimer, I have a little one in the house. If you hear some rare unnecessary noise, uninvited talks, please bear with me. But thank you everyone for turning up for this yet wonderful conversation. Us having you here means we have ambassadors. We have, our voices are going to be amplified and multiplied. So, again, great thanks to Dr. Suzan for turning up and giving her time to share this expertise that we all need to ensure that, ourselves, our friends, our relatives, our neighbors who suffer road traffic injuries still get helped with their mental health. But as the conversation goes on, perhaps you understand that even us who view what happens, perhaps we even suffer more than the people who have been into the accident itself. So it's a great time, and thank you again for joining. Please, as the conversation goes on, encourage a friend to join, because at whatever time they join, I believe they will get something to take home. Again, my name is Eric Senun. I'm a medical doctor and a global health specialist, focusing on equitable surgical systems. I'm currently leading the Gulu Safes Roads campaign 2026 with a vision of promoting road safety and averting preventable death and disability as a result of road traffic accident. And again, I'm very excited to host to host our guest speaker, to host Dr. Mtunga, who will be our moderator tonight, to talk about yet this very important issue. Thank you and applause to our collaborators and partners who have
Or what comes next? I
Dr. Eric, it seems you're breaking, or is it only me who is being cut off?
Hello, friends. Is everything okay on your side? I just had a few internet hiccups. I wish to confirm if the meeting's going on.
uh, I thought it was me, Susan.
Yes, I'm here.
Okay. So the entire time I was making a call, were you able to hear anything?
No, I actually thought Eric broke off from my side, so I thought maybe it's his side.
Oh,
Sorry.
okay. So I guess because he's the host, when he got an internet glitch, then it was downstream because I was also experiencing the same. I thought it was my network.
Oh, sorry.
Anyhow, now that we are clear, let's survive the moment. So, thank you so much
And
for all those who have joined
it
us.
seems it might have caused people to drop off. So everybody
Oh,
else has to reconnect because I see now attendance is like 5 people.
oh, I can see 13 on my end.
Oh, really? Oh, okay. All right.
Yeah. So, I think we shall go on just to make sure that we can still go on. So, thank you so much, Dr. Eric. He was introducing himself and telling us a bit about the project, the Safe Roads, Gulu Safe Roads project. And yeah, oftentimes when a road traffic accident happens, we often measure the damage in fractures, blood loss, head injuries, and how many people have died. But we don't actually recognize that, you know, trauma does not end when the bleeding has been arrested, you know, or like when someone has healed physically, then the trauma has ended. It hasn't. If anything, there is some other injury which is psychological, and this may not show up on our X-rays. It may not show up
Mm.
uh, physically, but it is so profound and it affects whether people return to work, whether someone gets back on that motorbike, whether someone will ever drive again, and whether they will even be able to relate with their family and even get back to integrate into living life as they were initially in the community. And the World Health Organization explicitly recognizes road traffic crash survivors and families to have needs beyond the physical. They have needs beyond medical. So these guys will have physical needs, they'll have psychological needs, they may even have legal issues going on even after the accident, and for some even economic, because rehabilitation may cost a little bit more. People may need ongoing support that is going to be paid for out of pocket. And so this topic is just very, very important. And I'm glad to have Suzan on board. And so to you, Suzan, what does the psychological aftermath actually look like, and how soon does it surface, usually during an accident? Over to you, Suzan.
Thank you very much, Dr. Mtunga, and I really appreciate this time. And I constantly appreciate this initiative of Gain Community Health Initiative, of especially integrating mental health into the Safe Roads campaign. It is very creative for you to do so. I think creative might be an understatement. I think it's very thoughtful that you actually were able to recognize that this is a crucial aspect of actually road safety. And without undermining the physical effects of road crashes or traffic crashes, and we want to really take time to take a moment to remember those who have lost their lives through this time. I want to say that it is also the beginning of a bigger individual, family, community, national war after the traffic crash itself. Because there is so much psychological issues that get to be involved. And even at the start of, okay, let's say the number of death that happened, the fatalities that happened due to road accidents is alarming in Uganda. And this alone, it gives a psychological burden to the families. We are looking at a country full of young people of more than 25 million. And of this, 80% of them are actually young people, are actually people who are doing informal jobs. This involves riders, drivers. Most of them actually fall into that category. But we are also seeing the psychological burden of somebody dying suddenly, and immediately the person who is a source of income to the family is gone. That leads to prolonged grief. And those are all psychological issues. And we want to talk about a case, well, we thank God for when you survive. We say, thank you, God, for the survival. But most of the people are actually working with psychological issues of the aftermath of road crashes. Research shows that over 25% of people who have experienced or encountered traffic crashes actually end up with post-traumatic stress disorder. Post-traumatic stress disorder is a mental health condition which is usually diagnosed 1 month after 1 month. But they can be symptoms, acute stress disorder that can be similar to that. A person might be hypervigilant. A person might be extremely avoidant. We're talking about a sudden behavioral changes like this. The person was not like this before, and after the crash, this person is extremely hyper vigilant, meaning the person is looking for danger all around them. They are looking, okay, what's happening? Who is that coming in? That's hypervigilance. We're looking at a person who has intrusive thoughts. Intrusive thoughts means that you are extremely overburdened by thoughts that cannot enable you to concentrate. If it is at work, if it is in anything that you're trying to do, it is intrusive. You continue to have those memories of the accident, the scenes seem to be playing over in your mind. And we are having people who have, of course, that leads to you having failure to sleep properly. An adult should sleep at least 8 hours, 8 to 10 hours, but you find somebody who is struggling now to sleep. And of course, that leads to other issues. Some people end up now struggling because you're trying to cope, and you end up now, you have to use substances and drugs to be able to maneuver and try to do that. And that, of course, has later on a prolonged use of that leads to addiction. And of course, that becomes a functional issue because you have difficulties related with your family, doing your work, your normal job, and that becomes a problem. We have statistics showing people later on develop depression. We are looking at a human being perhaps who has just witnessing those that disturbing scenes. We're looking at another person who has who might have lost their limbs, who might have lost their facial or physical abilities. Maybe your hand is cut off, your face is deformed in a certain way, and now you're struggling to accept the person that you are. You're dealing with pain constantly, and that leads some people to depression. And of course, severe forms of depression, people who are severely depressed are likely to be suicidal. And those are all completely compounding psychological issues. Thank you so much.
Thank you so much, Suzan, for that wonderful breakdown. And to our listeners, we are discussing um, mental health, especially during road traffic accidents, which has been mostly ignored. We usually focus on the physical, and for us medics, looking for bleeding, looking for fractures. But today we are looking at the mental health aspect beyond the physical. What are the things that we need to do? And yeah, you've touched a lot of things, Suzan. You touched about shock, disbelief, intrusive thoughts during the moment because it's such an intense moment. Someone has just survived. There's a lot of overwhelm. Emotions are in the roof. So in such a moment, people need a lot of psychological first aid. And I'm glad you've touched some of the things. Maybe to other people who are listening in, they may want to know how would you help someone who is going through these things in that moment? Like what kind of action would you take in that moment? And so it would be just nice to know what someone can do in such a situation because we experience quite a lot, and accidents in Uganda are just so common. So it would be nice to know how we can integrate this mental health into crash scenes, such that we are able to provide care beyond physical care. And so, from your discussion, we've also seen that it's not just visible pain, it's not just physical pain, but during a crisis, people need to know that even when someone is not, for example, panicking, someone is not showing those other psychological signs, it doesn't necessarily mean that they are doing psychologically okay. And sometimes even the psychological sequelae can happen days or months after the crash. So it's very important for someone not to dismiss the mental health aspect of crashes, even if a time has passed, like some time has passed, weeks have passed, or months have passed. And that's very, very important. And the World Health Organization actually explicitly says that integrating care into post-crash responses actually improves survival. And this is through evidence. Maybe I'll just follow up with another question, Suzan. Um, this is our second question. What about first responders like border riders and bystanders? What can they do, and where can they, be a part of this discussion? How can they come in? What are they able to do in the moment? You know, to just be able to um, help someone who is involved in a crash.
Thank you very much. And I think that's critical, especially because our crash scenes have become quite more brutal. There are more confounding factors than the accident or the crash itself. Because there are other factors. For example, now we see the bystanders, some of them become people who are grabbing property from those who are affected, and that compounds on actually the suffering of the individual itself. And so that's the situation that we see in Uganda. And I think that becomes important. Of course, we can also say it's part of the moral decay, because now those who are supposed to help you might actually be a part of those who make it worse. But I think today we want to talk about the positive aspect of those who want to help and they don't know how, or they're trying to help in how they can help. And our discussion is to say, okay, how do we improve the quality of immediate support to those who have been affected during the crashes? And so it's important, and I appreciate that there is physical first aid that's important, and this is what we mostly the medical teams do. The ambulances run on site, the emergency medical teams, the people really come to help, and the local communities come to support in the way they can. And but of course it's good to know how do you do it the right way so that you enhance a person's ability to actually cope with this kind of traumatic experience. There's what's called psychological first aid. Psychological first aid, it is not a guarantee that once you offer support through evidence-based psychological first aid that the person is guaranteed of no psychological effects later. But research has shown that people who receive appropriate care through psychological first aid will fare well and will cope better with the experience compared to those who did not get any support or who might have got it in, maybe in a negative way. So psychological first aid simply means the first immediate support that a person in crisis is given to enable them to meet immediate needs and to enable them have calm and reassurance and for them to be able to access the services that they need for those immediate needs. This is what really psychological first aid is. And I'll break it down to say it simply means one is to listen. Listening, in this case, for example, a bus has crashed, and your work as a border who is on scene, a community person, is to simply listen to see, okay, who is in danger. Look out for a person who might be critically injured, who might be, in a severe form of physical trauma, who might be yelling, whose leg might be, in a way that they need help maybe more urgently than others. So this is the most important thing that we do. Also look out for danger. And in here, we are trying to ensure safety. Is there a nearby fire that might be, or is there petrol which is flowing around? Then try to do what you can do to move a person to safety. So that becomes an important aspect of survival, because if this person, imagine, is bleeding and they're seeing the next danger is actually coming onto them, that becomes much more frightening, much more traumatizing for this person to actually encounter. So listen, look and try to see who is around you, who needs help first. It might be overwhelming also for the person who is trying to support. And so you look for who needs the help first. And then listening is here you approach the victim. May I help you? My name is Suzan. I'm just from this community and I'm just here to support you. Approach in a way that the person understands you're there to support them, so that it is not overwhelming, because everybody will be cautious. First of all, they will be confused. They are confused. They can't put all things together. They are disoriented. They don't know what's happening. They don't know where they are, because this is what happens immediately after the accident. So here you introduce yourself and how you're trying to help them. Listen actively to what they might be trying to say, to speak, because they might be trying to tell you what is really happening, or which part of their bodies is feeling a lot of pain, or or maybe the most important thing to them at that time is their child who has remained in the car. Listen so that you understand what is their immediate need that you need to respond to. And then we need to be able to link them to help. And of course, here, you're not going to promise what you're not able to provide. If you're able to call the nearest police station, if you're able to call the nearest medical team, the nearest hospital, if another colleague is trying to get for help, just reassure the person that now they are in a safe place. You're trying to support, and help is coming. The medical teams are on their way. The ambulance perhaps you reassure them that something is being done about the situation. This helps to calm that person down, to stabilize them, and to reduce the magnitude of disorientation, panic, shock that is happening at that time. We said that these things are going to help this person to fare and cope well with this experience later on. And the reassurance here is you're trying to tell them that, yeah, like I said, that help is away, the vehicle has stopped, it's no longer happening, the fire has now stopped, whatever it is that you can see, and because you're an outsider, you're able to see things more objectively than perhaps the person who is there. And of course, here you're also trying to create a physical shield to ensure privacy, perhaps to ensure that, for example, if it is in the middle of the road, you're trying to stop traffic on the other side and try to ensure that not more harm is done in the process of you trying to intervene and support the people who are there. Like, in Uganda and across, anyway, it's a global issue. The issue of smartphones, everybody is interested in taking that tragic scenes. And so the people, you're yelling for support, but somebody is actually taking a video of that experience. And how do you feel? Just imagine in this call, you who are on this call, how do you feel at that time when you're fighting and crying for your life and somebody is actually taking a video? They are trying to get as much following as possible because of your experience. How would you feel at that time? I would love someone to type in the chat box. How would you feel? Just imagine it is you. Establish a calm presence at that time. Try to enable this person to speak slowly and in a language that they can understand if possible. If you're able to
But you
use the
host,
local language, talk to that person. If you're able to, because there's a lot of shouting, there's a lot of, and then you cannot also come shouting in the way of trying to help. Now for you have to lower your tone and try to actually be of help to this person. Breathing exercises help a lot to reduce anxiety, to reduce shock, to reduce that disturbance of that time, disorientation. Allow the person, help them to breathe. Allow them maybe 4 seconds to breathe, and you can count breathing. 4 seconds means you in and out, and you can do this together with them. Again, in and out. Breathing stabilizes mood immediately and able to orient a person almost instantly. So breathing exercises really help a lot. Also grounding, because these people are confused, they are disoriented. So it's important that you can help them to ground. And there are some techniques that help a person to ground immediately. For example, allow the person to identify what are the 5 things that you can see. What are the 5 things that you can see around you? If that person can name, okay, I see water, a water body. I see cars parked. I see people around me. What are those things that the person can see? You are grounding this person. You're enabling this person to recognize that they are now in this place. They were not in the bus. Now they are in this place, which is not the best place, but it might be safer because they might be still. The problem with a traumatic incident is that it fixes your memory to a time of the incident itself. And so you'll be thinking you're still in the fire, you're still in all that. So grounding helps a person to see, to actually take a moment to see what's around them and to feel around them. Tell the person, touch your, what can you touch around you? I can touch my hand. I can touch a car tire. I can touch maybe grass around me. I can touch maybe water. What is it that you can touch around you without making the person move, because you don't know the extent of the injury? This is why we are again working collaboratively with the medical teams to ensure that we are not doing more harm at that time than good. So because some people have limbs which might be dislocated, and you might be doing it the wrong way by just moving. But again, this is why it becomes critical that we integrate actually the medical first aid together with psychological first aid, because then we have a team, the frontline team, that is very equipped to appropriately respond. Ask the person, what is the sound that you can hear? You're grounding. What's the sound? I can hear birds. I can hear water flowing. I can hear people's voices. I can hear this and that. It helps the person to now recognize and accept and relate to the current environment where they are. And you can ask them to smell. Is there something that you can smell? Maybe I smell petrol. I smell dust. I smell, I don't know, whatever they can be able to smell at that time. It helps the grounding process. And you can also ask the person to say something positive about themselves at that time. And a common one is, I'm alive. Because sometimes we are focusing, okay, my leg has broken, but the most important, actually, you're actually able to mention that your leg is broken. I am alive. And that kind of becomes so supreme over everything else, the importance of life and appreciating it itself. So those techniques help the person to recognize, okay, they're actually not perhaps in an elusive world. They're actually here, present and now, breathing and are able to live again. and physical safety anchoring. Here you're able to be able to I think I mentioned it earlier, to avoid onlookers from doing things like taking phones. So you want to be able to support and ensure that this person is shielded and supported. I hope that helps a bit of tips for somebody to be able to help somebody out there. Thank you.
Wow. Thank you so much, Suzan. Yeah. Uganda, we are so much about content. We want to milk content out of literally everything. We want to trend, we want to be the ones sharing the news. But behind all that, behind all those efforts, even doing things which are very, very weird, as taking videos and images of people who are in dire situations, it's all rooted in wanting to trend. People want to trend, people want to get reposts, people want to get following, and they will go any mile. So thank you so much, Suzan, for pointing that out, especially the role of empathy during accidents. It's very important that we realize that this is a human being. At the end of the day, they still need care, they still need support. Yeah, you talked about looking, listening. Yes, be a listener, especially during the time when you're responding to someone in crisis. You have to ask yourself if the person is physically safe. Are they still in danger? Do they need an emergency support? You know, do they need a medical attention? For example, for us as medics, are they conscious? Are they bleeding? Are they confused? Susan talked about reorientation, like asking the person, where are you? What is going on right now? Can you name for me a few things around you? Can you tell which time of the day it is? Do you know your name? Things like those. They can help the person to get reoriented. Yes, you have a fracture, but the overwhelm can be reduced, then the doctors can deal with the fracture. But in the moment, you want to minimize ongoing harm during the crisis. So this is very, very important. And during the response as well for these road accidents, it's important that you can ask yourself, is this person alone? Do they have some people that they are with? Oftentimes in Uganda, people are traveling with family, where their children, where their husbands, where their belongings, you know, have they been separated from people who provide care? All those are important questions to ask ourselves as we respond. Um, and for the listening bit, like Susan said, please, we're not interrogating and you're being as kind as possible. So saying things like, you're safe now, I'm here with you, is there someone that you wish us to contact? All those are responses that um, we believe can help someone in the meantime. Or you can even ask someone what they would need the most at that moment. Even that alone can help the other person. Then Susan also talked about collaborative care, linking this person to care. We need to be able to link the person to care. Yes, we've given the first aid, but we now need to link them maybe to their family, to emergency medical services, maybe to health workers who will provide ongoing care, to psychological support providers. We may need to give a lift of maybe carry this person to a place. You may also offer follow up. Even that is very, very um, important. I think also we should also be mindful that during our attempts to intervene, we should not force someone, for example, to recount the events of the crash. You're very aware that this person is having a need. Just address the need. Don't ask them what happened, or you're re-traumatizing the person, because as they narrate the story, they are going to recount the whole experience, and they are going to end up traumatized. And should I warn you that in sometimes when you're asking people to recount their experiences, you're also putting yourself in a place where you can be traumatized, because by the time they are done narrating, you could be crying. You could end up actually needing psychological support too. So don't be in a rush to ask people to explain to you in detail what happened and all, you know. Don't minimize people's experiences like, forget about it, just be strong, everything will be fine. Those are generic statements and no one relates with such. But being real, being empathetic, being kind, those are things that actually get people to calm down, to realize there is actually help. Someone is here to help me, not to not to take a TikTok video. You know, I'm not going to find my broken limbs trending on TikTok because someone is looking for content. That is very, very important. Thank you, Suzan, for highlighting those things. I couldn't add anything more. And now we are bringing it to the advocacy part. Um, if you had the ear of Uganda's road safety and health policymakers right now, what is the one thing that you think you'd push for to get mental health built into how we respond to road traffic injuries? Suzan?
Thank you very much, Dr. Mtunga. Well, I think there's more than one thing that that I should actually put forward, and one is to really emphasize on enforcement. We have the Traffic and Road Safety Act, but to what extent is this actually being enforced? I know that it's enforced by the Uganda Police Force, and we see every day the traffic officers on the road. To what extent is this being enforced in terms of being practical? Why are still people driving while they are drunk? What happens? What is in between there when there are traffic officers on the road? Why are people driving quickly? Why are people driving while of course, I know that we don't have a surveillance system for mental health to know, what's your psychological level, mental health state at the time of driving. That would be interesting to to actually to have a surveillance system, because this, somebody is, because I usually see people rushing to, like, they are driving like their life itself depends on it. And then you ask, okay, what can actually be more important? If we actually asked ourselves, what can be more important than your life itself? Like, what you're running for, what? To sign a contract? That's a deadline? Okay. So if you die, what happened to the contract? Those are things that the Traffic and Road Safety Act enforcement, to work effectively with the traffic police to actually be able to enforce this, would be something that I would desire that our country is on book to do that. We also have an occupational and health, I think, Act of 2006, that of course puts the employers, gives them obligation, but it emphasizes on the physical needs of occupations, or the occupational hazards. It emphasizes on the physical occupational hazards. But I want you to imagine, like we said, if 25% of people are likely to develop depression, post-traumatic stress disorder. Another statistics actually say that 60% of frontline workers are likely to be burnout. 30 or almost 40% of nurses dealing with trauma victims are likely to develop secondary trauma. To what extent are the employers or workplaces able to actually consider this and know that, okay, this person, what considerations in terms of policies at workplaces are there to consider the psychological aspects of the psychological occupational hazards? They are not there. It's not being considered. As long as you come back to report tomorrow alive, then it is business as usual. It's business as usual. The emergency teams every day are on ambulance going to intervene in these places. It is business as usual. How I wish that there is a relationship emerging of this kind of occupational and safety act together with the Mental Health Act, for example, 2018, whereby it becomes practical that actually we now intentionally take care of the physical needs of the people. A month or so ago, there was a walk-in because we received a walk-in into one of the public campaign that was being done, and we participated. And a border just walked in because the vests were being given for free. So he checked out tents, like what society with an active suicidal plan. Now, this is a person who is carrying Can you?
Eric, is it me or
I think there was
Susan
a
having
there
bad
was.
network?
Can you hear me?
Yes, now I can hear you.
Wow. Okay. I don't know where I got cut off. Perhaps. So mental health surveillance. I think my takeaways on policy is the merging of the Occupational and Safety Act with the Mental Health Act, regulation for uh, the traffic and Road Safety Act. That would be important, and then mental health surveillance, like the example of the border that I was giving you. So this would help in terms of policy. Thank you so much.
Thank you so much, Susan. Yeah, definitely. This really needs a multifaceted approach. It can never be just one thing fix all. Thank you so much to our people who have tuned in, and the floor is open for anyone who has a submission. Any questions? Let me just see in the chat if there's anything I can read. Um, this is Patrick. Patrick says that is creating another psychological pain, even more than the physical pain. Photos and videos shouldn't be a priority. Yeah, recordings shouldn't be a priority. Definitely. And this starts with you, and it starts with us all. We need to talk about these things. I usually use my own social media to talk about things that I feel like matter. And because it's my social media, it's my TikTok, it's my X, it's my Instagram, it's my YouTube, I feel like I have all the powers to speak to the things that matter the most to me. So I encourage us to use our platforms. If you're a church person, you go out with the boys. You're a footballer. You do concerts. You do debates. Just use whichever platform you have to speak on things that matter the most to you. To speak on things that you think could change for the better, because we often think that we need a very big platform and then we need a lot of money for us to stand up for something, but that's not true. Just if everybody where they are does something small for positive change, I believe it is additive and it's cumulative. So we should move beyond, blaming road users to designing systems that offer um, choices that are easier. So we can see clearly from this discussion that it's not just about the road users. It's not just about mental well-being of the people. It's not just about people showing up and all, but it's supposed to be systematic in a way. The traffic people are doing something, us as a community we are doing something, healthcare professionals are doing something, everyone putting in sort of an input to make sure that we respond well to road crashes, we reduce them in the first place, and we ensure that the people who are involved actually get the support that they need. And as a clinician, one thing that concerns me is that when a road traffic survivor reaches out, our first instinct is to look out for bleeding, fractures, head injuries, shocks. But the absence of a visible injury, does not mean that there's no harm ongoing or there's no harm done. So we need to, like Suzan said, integrate psychological and mental support into our trauma and crash response. I want to welcome Dr. Eric to contribute to this discussion in a way. He's been quiet because I was focusing so much on the guest speaker. But this is where you come in, Dr. Eric, as well, to share on this topic. And as well, our listeners, if anyone wants to ask a question from our guest speaker or to any of the panelists, or anyone has a contribution to the discussion, please, you're welcome. Dr. Eric.
Yeah, thank you so much, Dr. Mutunga. Thank you so much, Dr. Susan, for that very wonderful and insightful discussion. Again, to back to the reality, I think possibly some of us have been in the system, especially the medics. On a daily, the patients we actually see, we focus on caring for that, breathing site, making sure that the limb is well aligned. And some survive and actually get, the surgery that is needed to save the life and the limb. But possibly the much needed surgery would have been or would be the surgery of the brain, not necessarily as in head injury, but possibly, I don't know if the term is right, mental health surgery, if I may say so, is one critical component that we've missed. I still have doubt if among ourselves we are actually competent enough to even assess for mental health disorder, for example, anxiety, depression among these. And I think moving forward, I see lots of colleagues on call. We need to team up and see how to do some of these studies. I think these are some of the missing links in the literature. Health workers' competence or ability to assess for mental health disorders among road traffic injury victims, or even also the prevalence of those, for example, in admitted patients within the hospital. So moving forward, we need to back this up with research as we move the agenda to advocating for integration of mental health care into injury care. And again, we're not going to be working in silos. They already established trauma systems. Those things are still not yet working out. But I think as the country embarks on developing robust trauma systems from pre-hospital to in-hospital and then rehabilitative care, it's our opportunity. It's a golden opportunity for us to have mental health component incorporated in. And once again, I appreciate you all. Please, let's share our experiences. I know you might not have been a medic to care for a patient, but perhaps even you had a friend or even yourself. In the recent Opi past instance where we lost over, I think, over 24 people. I mean, even if you didn't have to be a relative of anyone for you to be traumatized, the pictures alone could actually traumatize you. So feel free to share experiences. And at this moment, I want to inquire from our guest speaker, perhaps, in this era of advancing technology and AI, uh, how do you see us utilize these advances, not further widen the gap of mental health care, but narrow it and ensure that even those who are injured or the communities where these incidents happen are protected mentally. Thank you.
Thank you very much, Dr. Eric. I would start with what you mentioned earlier on integration of mental health services in
Dr.
routine
Eric,
care.
your network is not.
This is important because there is a lot, very high comorbidity for
Suzan,
every patient. There is feedback, I don't know from whose side. Hello?
Yes, sorry about that. I think they are now mute. Joseph, you want to mute?
Okay,
Thank you
yes,
so much.
members, thank you for muting. There is very high comorbidity between physical illnesses with mental health and sexual support issues or challenges. Somebody can walk into a facility and they have a high blood pressure, but they might be depression coexisting, and the doctor will focus on only the pressure you give, and but you'll find this person later on is not improving, is and you keep either doubling the dose, changing the medicines that you're prescribing, but the person is not improving. It's because something was missed. The depression was totally missed because there's no way you'll fare well when you are having all these things that actually increase your pressure instead. So that comorbidity is very common among our patients now. It's important to pay attention, and this is why there is a WHO program called the Mental Health Gap Action Program that intends or that does integrate mental health services into primary health care or routine care for patients. It starts with a training of health workers of all cadres and also focuses on all the levels of primary health care, right from the VHT, that's our first health care system in Uganda, up to the national referral hospitals. So that helps in that sense. But this is also something that we do as Wellnest. I was the program manager for the pilot image gap program, so I'm very equipped to be able to do this, because if you wait for Ministry of Health, which we also work with, to sometimes do this on a private basis, the country, the Ministry of Health is trying to roll out this as a national program, but because of funding, it's very, very limited. But if your health facility is able to facilitate, then we're able to have trained national experts for MH gap come to support you. Eric, I think I have lost your question a bit. Can you please repeat? Can you repeat again,
I
please?
don't think I don't think I followed the question either. If Eric can repeat, ladies and gentlemen, you're welcome to the webinar. For those who are just joining us, we are talking mental health and road crashes in a nutshell. I forgot to recognize our Dr. Charlotte. She's the supervisor for the Safe Roads campaign, and she's a UK-based emergency physician, and she works with Lacho Hospital. On the webinar as well, we have several department directors from CPHS Uganda, where I am one of them. I'm in the medical department, but we also have Miss Rosemary Kitui, our innovations director. We have Madame Betty Dorothy, she's our executive director, and we have Madame Winifrida Watsemwa. She's also our assistant director, medical services at CPHS Uganda. We are all here, happy to collaborate with the Digital Health Initiative, and happy to be here. Someone called Fiona David, are you sharing? Okay, I guess it was an oversight. So thank you so much for joining. Dr. Eric, if you're able, please repeat for Suzan. The question's a little bit abstract. She just wants to be clear that she's understood what you were asking. I think it was to do with AI, how we can leverage AI and something like that. But I also had bits of it. I didn't hear the entire question properly. So Dr. Eric, if you're able to rephrase the question.
I think it's okay. Dr. Mtunga, now I remember. I think when you mentioned AI, then I remember he was speaking about the social media and on how we can actually protect the people. I think it starts with us putting ourselves in the feet of a person who has actually experienced a crash. That's why earlier on I said, can you imagine if it is you in this state? What would be the best care and support and response that you would wish people to give to you? If that empathy is translated into how we view every case, every crash that happens, perhaps our responses are going to be quite different. You would not want to take a picture of a naked person because they are compromised because of the crash. Would you want that to happen to you? So it starts with thinking about the dignity of the people, empathy, and if you have to share, please share a picture that still leaves the person's dignity held up. And you can still share the same news in a more dignified manner. You can still take a picture. Either you can mention it, and you can cover the faces of the people. And you don't have, now that we know that it's not only about seeing the people physically that affects others. The audience, I would like you to know that social media, looking at continual persistent exposure to potentially traumatic pictures. You're seeing people in the pools of blood, their broken bodies, their broken limbs, the head is crushed to the other side. Tomorrow again, you're looking at these kind of pictures and videos. That becomes your own traumatic experience. And you are exposed or more vulnerable to develop a condition called secondary traumatization. And you do not want to do this. So also be cautious as an individual on how we can be able to be cautious on what do you look at. Some of the times I'm actually able to avoid, because you have the rights on your phone to download or to auto download. So you can choose what to view. You can choose what to watch. So I'm looking at both sides. If we cannot have control over the person who is posting, you have control over what you can view. And that will help both of us. That the other people will start to filter what they share. And you, the recipient, can start to filter what you want to view. Especially research has shown that viewing traumatic and disturbing images and videos towards your sleeping time, and if this becomes a practice, will expose you to anxiety and trauma-related problems and challenges. Most of the time, if you want to do a very good, quick exercise for yourself, try to see something disturbing, get disturbing news, and then you go to sleep. You'll find that night, certainly you're going to struggle to sleep. You're going to be imagining what you saw, what you heard, what you viewed. And it starts with that. And at night, you start having nightmares and dreams. That's how it starts. So I think all of us have something that we can do to be able to prevent after effects, and especially the psychological effects of traffic crashes. Thank you so much.
Thank you so much, Suzan, for again emphasizing those very, very important aspects. It's important, ladies and gentlemen, that we'll have these conversations and let it not stop today. Let it not stop today. Organize mini CMEs in your hospitals. Organize small learning sessions where you work. Let this conversation keep going. And we are looking at CPHS Uganda. We have a program called Mind Your State, and we're looking at empowering healthcare providers, especially emotionally, because that has always been the missing link. And Suzan, I will knock on your door soon. We need to be able to come up with probably small courses that we can train in that line. Ladies and gentlemen, I also want to recognize these people. We have Dr. Erikana Nduhura. He's a global health security expert. I don't know if he's still here. Yes, Dr. Erikana is here. Thank you so much for joining. Dr. Erikana is a global health expert from the University of Global Health Equity. Thank you so much for being a part of our discussion. And then Daniel Maka, President of UNAU, Gulu University Chapter. Thank you so much for honoring our invitation and also for being on the call. And at any one point, if anyone has something to add to this discussion, please, the microphone is open. You just, you can show us by hand and then we shall let you contribute. But also the conversation can keep going in the chat box. We shall be able to keep the, we shall be able to invite you to be able to contribute. Don't be left out. Eric, do you have any follow-up questions for Suzan?
Not really, not a question. I just wish to appreciate her for the wonderful responses. Thank you so much, Dr. Suzan, for that. Again, I've noticed that the recent technological advances, including AI, we realize that, we're mostly using these, in most cases, negatively. But then if we focus to actually make better use of them, I think there's lots of potential. Dr. Susan just made mention about a mental health surveillance system, and I was like, wow, with this new AI algorithm, large language models, colleagues on call who is an expert of AI, that can be a very, very amazing project to, embark to take time, but again, eventually prototype might come and on mass of Africa. So I encourage us to explore because then through innovation that again some of these problems will actually be solved. Again, at this moment, Dr. Mtunga, I wish to hear from Dr. Charles. Dr. Charles works perhaps in a much more established setting where she practices in UK. So let's hear from her experience. How is the practice in UK? Do you have a mental health expert by the bedside within the casualty? Do you guys have mental health experts? Or even in pre-hospital setting, how is the practice regarding mental health care for injured patients? Thank you so much.
Hello, thank you, Dr. Eric, and thank you, Dr. Suzan, for all your contributions and your wise words. So in our setting in the United Kingdom, we do have mental health facilities which are available to patients. But generally speaking, if they come in with trauma, they don't automatically get seen by a mental health provision, a mental health team. And generally they will have primarily their trauma will be dealt with, their physical trauma will be dealt with first. I think probably the psychological effects will sometimes take quite a long time to begin to manifest themselves. Obviously, there's the initial shock and I guess distress of the patient, and they can be very overwhelmed initially, but your priorities are to save the life. So those tend to be where the focus is initially. And I think the psychological things can very much be overlooked. When the patient is adequately treated, either admitted to a hospital ward or discharged home, that I think is where the psychological effects can be picked up, perhaps more effectively. And in our setting, we have family doctors, our general practitioners. Very often, if a patient is finding sleep problems or difficulties with coping with their experience, they will start by going to their family doctor. And that will be their first way to access some support. And occasionally that will lead to a referral for psychological support from specialists. But sometimes it's just acknowledging to a medical professional and the professional acknowledging also that they need time away from their work, or it could be, they need the support of family and friends. And sometimes there are also victim or fellow sufferer groups that they can actually take advantage of. So particular groups that could be affected are people who've suffered from amputations or are struggling with sleep or feeling traumatized by other particular aspects of their experience. I think it's a very important thing not to forget, but I think very often it is something that emerges a little bit later on when the victim of an accident is recovering physically, but not necessarily psychologically. So I think our structures are also really quite undifferentiated and not necessarily very well thought of. So I think, we can all learn from trying to support the victim at the time and be reassuring, but also be conscious further on down the line of their post-traumatic stress disorder and their needs following the event. Thank you.
Thank you so much, Dr. Child, for those wonderful insights. Again, like you made mention that this is a great learning opportunity for us all to pick a thing or two, so we can help improve our systems. So thank you so much. Yeah. How about you, Dr. Mtunga? I see Dr. Suzanne's hand is up. I think I would also wish to hear from some of our colleagues who are not medics, as that it doesn't get biased. I know Daniel has been at the forefront in UNOW. I remember during his time as a UNOW. UNOW is United Nations Association of Uganda. They were great champions of road safety, and you now still continue to champion road safety in different parts of the country. So from your experiences, please, we would invite you to also share your perspective. Thank you so much. Over to you, Dr. Susan, and then we can hear from Daniel later. Thank you.
Thank you so much. I just wanted to follow on with Dr. Charlotte. Thank you for your inputs. I appreciate especially when you mention about the self-awareness of a health worker. And I think also the other component is the importance of the integrated approach where the response teams are just aware that there are individual factors for every person who has experienced a crash. There are those who might manifest. Actually, there are those whom the crash was just a trigger. They have already been having vulnerabilities that were just waiting for an opportune trigger to flare out the span of psychological challenges. And for instance, in the recent crash of the bus, a day later, I was called to intervene for a survivor who was hypervigilant. She wants to run away. She's making noises. So that kind of person presents a typical case of a person who already had vulnerabilities. And so this crash now only becomes a trigger to flare out the issues. And that person may manifest the symptoms immediately. And this is why before the first month, then we can diagnose somebody with acute stress disorder because they will have very, very similar manifestations with post-traumatic stress disorder. But there are some people who may seem to be, they seem to be they're doing okay and everything, but later on, there's this sudden explosion of the psychological challenges that happens. And so I think it's an individual factor, and people will fare well differently. Thank you.
Thank you so much, Dr. Susan, for that wonderful insight again. Yes, Dr. Pugamon was taking over your role, but anyhow, I think I was just curious because I know some of the people in attendance, and I wanted to handpick them
Don't
just
worry.
to trigger this
The-
discussion to be richer.
yeah,
Thank you.
I don't mind sharing. I don't mind sharing any platform with you, my big dog. Yeah,
Thank you so
yeah,
much, Dr. Mutunga. Let me
yeah.
take this
Thank you.
opportunity to invite Daniel Maka. If you are you're free to unmute, please. Put your comments, share your experiences from the work you did in you now, and what you think about this subject. Thank you. Over to you, your excellence.
Good evening, everyone. Nice meeting you again. I'm called Mwaka Daniel. I'm an engineer by profession. When we are talking about mental health awareness, something including after accident problem, those issues that arises, I know you doctors knows better. To me personally, I've ever involved in one of recent, some few months back, and I know how it takes. So I'm one of the victims. I was once working in a certain road, we are constructing, then towards the park, then we got some elephant fighting us. So since that day, I be like figuring out how that elephant came around, how we fell, how I got the injuries, and up to now I've not healed. So now, to me, I think to fight that mental health is to practice to how to face that fear of having that accident. you'll find that those operators, those border riders, if they get accident, for them they don't have much problem like the passengers they carried. You find the operator or the person driving that bus feel like as if the thing is normal, yet the passengers, they feel that trauma, they feel a lot of fear, they feel like they're about to die. So in such cases, as an engineer, I feel like let's face that fear. If you cannot now ride that picky for long, you can get like use an AI, you can get those app, you can get those games, you be playing them so that because you cannot reverse what had happened. When you have already broken your leg, you cannot reverse that what had happened earlier. So it will be better for us to face our fear when you have no option. You have to just face those what had happened to us. And what I wanted to put across is like as an engineer, there's also a problem with the roads. You find these other engineers that have made the road in a different way. When you're in a bus and the bus is speeding around 80 kilometers per hour, you feel as if you are dancing inside that bus. And to weak-hearted people there, they've already got an accident before the bus has fallen. So that one also, for us to fight mental health, it start before even that accident has happened. Those other operators, those drivers, they have to be sensitized. And I think that some will be like meeting again and we'll be talking about them. I appreciate for coming up with this one. I appreciate Dr. Senyoni. He always like coming out with a solution, a brief solution we have ever had. Just a lot of accidents across the country. And people are actually facing a lot after that, those accidents. Some lost their kids, some even not those one who are directly involved. Those parents, those relatives of those people inside there, they are facing a lot. And I don't know how we can now sort them, how we can solve their problems. Find like they said, the other man who lost 4 kids in a one road accident in the same bus in certain school there. Such person, when during emergency, they're not going to look at those relatives, those people around. They're looking for those one who are involved. So as for during this period, we have to also engage those parents, those relatives of these people. They might also be facing a lot mentally, thinking, imagining how the thing got fallen, how the bus crashed, how everything messed up like that. And to security, I think after the bus has crashed, something like that, let's remove everything from the scene, from that victim people. Because after they have gained conscious, they begin to see actually how the bus crashed and they survived from that one. Again, like place some mark into their head, seeing how that the bus which was looking nice from Namayiba, again here it's now looking like as if it's a scrap for selling. So that one also, before anything happened, let's just separate the machine or those vehicles, those motorcycle which got the accident. Immediately let's separate them away from the victim people, so that whenever they wake up, they get a new environment and everything will feel like a dream to them. And let's explain too. Because for me, the day I got accident, if they would have removed me away from that grader, I would not see how that grader got broken. Like up to now, I be thinking how how can I survive when the two wheel in front has burst and that disappeared. So that thing keeps like I be imagining how the thing got into that position. So it's better we separate those machine immediately from people who got the accident. Maybe ambulance come, take the sick people away, We get the breakdown, we cook whatever is there, we go and keep it somewhere, maybe behind some police station, somewhere covered with the tents there, with carpet, not in the scene. Some people also get mental problem after that one. And people around who just come to take photos. For me, I've been involved. Now I'm forgetting. But you go onto TikTok, the second 30 scrolling, you get your photo there. When you're crying, when one of your legs is missing, yet you're about to forget. I think if there's another way, those things, if those social media could not accept them, but there's no other way. So people around, it's not necessary to take photos and upload it. You are just killing someone for the second time. You find like maybe you have got an accident and you have forgotten. After some 2-3 years, you get at the photos there with something you had never seen. And actually it is you who was there in such what situation. It will remind you, and every time you'll be having nightmares. I think I don't need to talk much. I will continue some other time. Thank you. Thank you very much.
Thank you so much, Mr. Daniel. Again, I don't know, it is just came abrupt having seen you call. But again, I'm sorry about what happened. And again, for us, it's a learning point that, mommy, don't cry, that the issue we're talking about is not far-fetched. It's within us, and many of us are affected. I'll tell you that perhaps I've also not healed from the recent patient I lost over like 3 months ago, I think. A young boy of 24-year-old brought in with an open fracture with a big wound on the thigh, brought in by volunteers in a car driving safely, only because they didn't help him appropriately to stop the bleeding. We lost the boy. So these are things that we're living with on a daily basis. Sorry. But the good news is professional help is available. And again, I will request Dr. Suzan, please share your contact details in the chat. If any of us wants to reach out, kindly help for the sake of the Safe Roads campaign 2026. Thank you so much. I hand over back to Dr. Mtunga.
Thank you so much, Daniel, for sharing your experience. Yeah, this conversation could go on and on, but we know that we have to be mindful of that time as well. But also, given that there's just plenty to talk about around mental health and crashes, so I believe that we shall continue going on. I believe that we shall continue discussing. I think I can read something from the chat. Someone says, let me see. Okay, this was Suzan Suzan is sharing professional help, and she has actually shared her number and she has shared her email. So for anyone in this discussion who feels they want to continue engaging with Suzan to know how best they can make their own program, please pick that email from the chat box to just get in touch with Suzan and say how to be a part of what she's doing. Friends, if there is no other contribution, we want to thank everybody who has turned up for today's engagement. We believe that these conversations are important because they help us to set the pace for the small changes that we make in our communities. Let us keep it going. Let us tell other people about it. This discussion is recorded, so we shall be able to even listen in even after that. Suzan, thank you so much. And to everyone who has been with us from the beginning to this moment, thank you so much. If we can prevent the crash, we should. But if it happens, we really need to be able to save life. And even after saving the life, we need to be able to help the people to reintegrate back into the community. Unfortunately, for some people, we need to have training for them to be in a position to deliver this care over and over, because a road user, for example, a border rider, is going to encounter crashes every once in a while. Either they're involved directly in the crash, they're the ones causing the crash, or they are witnessing a crash. So I love that we are having something for border people in Gulu, and I believe that it's going to really help a lot, because these are people who see trauma on the road on a daily, and it's not about to stop. I'm not being pessimistic, I'm just being realistic. Accidents happen on a daily basis, and so this is a very good initiative, Dr. Eric and Jane Community Foundation. Doctors who work in emergency care as well are going to continuously see people brought in with trauma. So this should be, Dr. Eric, I think, our primary focus, that the people who see trauma multiple times a year are reached out with the best resources and trainings to better place them, position them to be able to deliver care to people who need it in those dire moments of crashes and accidents. Otherwise, I'm Dr. Mutunga. I'm a founder for CPHS Uganda. Check us out, CPHS Uganda, everywhere online. You'll find us on X at CPHS Uganda, on Instagram at CPHS Uganda, TikTok at CPHS Uganda, and we have a WhatsApp channel as well. So get in touch if you want to know more about what we do. If you want to collaborate as well, let me share in this chat box our email. This is my personal email. It's actually not the organizational email. But in case you want me to be a part of something you're doing, you want to be a part of us as well, please feel free to reach out. I've shared my email and I've shared my number as well. To those who want to ask more about today's engagement and any further engagements, that's my email and that's my number. Or reach out to Dr. Eric and he will be able to link us and we collaborate. Thank you so much, everybody who has joined. I believe this is because you value community and you value your contribution to the small change that we can make. So thank you, Dr. Eric, as well, and Jane Health Foundation for hosting us and for organizing this. And for Dr. Charlotte, who is going to be our supervisor for the Safe Roads campaign, thank you so much for showing up for today, for sharing your insights, and for the expert advice. We look forward to learning more about what you do, learning more from you, and for contributing largely to the community that we serve. And from all of us at CPHS Uganda, we send love and we send best vibes. Dr. Eric, I think let me first invite Suzan for parting shots, then you will be the last. Suzan.
Thank you so much, Dr. Mtunga, for this opportunity. It's my wish and prayer that somebody has been able to pick something or two through this conversation. And again, like we're all talking, it only starts from here. Let's engage. Let's be able to do something, because each of us has something that we can do to save a life, to save a limb, but importantly, I am adding to save a mind and a person's mental health, because it does matter. My name is Suzan Akwii, and I'm a clinical psychologist. I have shared my contacts on the link that you may be able to reach out for further support or collaboration. Thank you and have a good evening.
Yes, Dr. Eric.
Thank you so much, Dr. Mpunga, for the wonderful moderation. I will just to give colleagues some room again. I've just been in Dr. Mpunga's inbox, telling him how perhaps he was meant to be a global health panel modulator, because then we need such people really who can help us digest some of these complex issues simply, to try to get everyone's perspective, because at the end of the day, solutions made by us are better taken up than trust. Sorry, this one is crying. Mommy. Sorry. Again, want to appreciate you all, especially Dr. Susan, for the wonderful time we've had. Thank you for sharing your expertise. Thanks for the advocacy that you're putting forward. And colleagues on call, let's not stop here. We now have action points. You either in the health facility, you can help out a patient. Yourself, you can get professional help, or yourself can extend that help to someone, especially the psychological first aid, or even help identify someone who could possibly be battling with mental illnesses, and then share with them professional assistance or contacts to professional assistance. This is one of the events that we are hosting as part of the Gulu Safes Roads campaign 2026. And we invite you to take part in the rest. We have a community dialogue coming soon on 22nd of this month. It's going to be hosted at Gulu University. Again, we're looking at hearing from every one of us. How has road traffic crashes, how have they affected you, your community? What can we do? And we believe through that we shall then develop robust solutions, but also solutions that are acceptable, and all of us shall be held responsible to implement. We have a bike ride and walk, yet another exciting event, because then we are upholding both our mental and physical health and fitness, but also advocating for road safety, demonstrating that we can coexist on road without, causing trouble to one another. That will be on 19th of September. And then following that, in October, we have training of the key community responders, that's the traffic police and border riders, giving them the key, a life limb, and I'll add again, mind-saving skill, because I'm excited to have Dr. Suzan on call to give those insights of psychological first aid. Thank you so much, and look forward to having you all in the rest of the activities. The recording will be availed again for us and our friends to review it. Thank you so much, and have a good night.